tomorrow and the next day. I'll be wearing.
Well, I think there's a clean energy bill coming up tomorrow or something, right? Loan fund, right?
Yep.
So I know we're testifying on many of these. I have a young man by the name of Jamal Lewis who took my slot on for me. Took the organization slot or request on the New York Climate Justice Council, and works with Energy Efficiency for All, which we're the health partner for the National Energy Efficiency for All.
Nice. I know the program.
Yeah.
Hey, I've got to start letting people in.
Yes,
Okay.
it's time.
It's showtime.
But we should stick around because yes, that sounds fantastic.
And if you need our help, let us know.
So I think we could start with introductions, and then once Peter, you introduce Ruth Ann, then Ruth Ann, you can start screen sharing.
So I will kick that off. I'm Ben Rausch. I'm the co-chair of the AIA Baltimore COAT, along with Zolna, who is also here. And we are doing a series of programs. We've got one this month, one next month, that look at equity-focused issues and how they intersect with the environment. And it's going to be great fun. If you are interested in joining the COAT, in being on our mailing list, in attending committee meetings as we plan for later this year, you can find that on the website, and you'll find my email, and then I will add you to the list. Peter Dew is moderating this presentation, and I joked, but I am fairly serious. He's a man who hardly needs an introduction, but I'm going to do it anyways. Peter Dew is the founder of Dew Consulting, a sustainability consulting company. He is a recognized leader in sustainability, and he is a fellow of the American Institute of Architects, a LEED fellow, a Living Building Challenge hero. Peter was instrumental in crafting and advocating for the Baltimore City Green Building Law, establishing the Baltimore Office of Sustainability and the Sustainability Commission, where he served as a commissioner for 10 years. Dew Consulting is a JUST recognized company. JUST is a transparency platform for socially just and equitable organizations. Peter?
Thank
Glad
you.
to have you.
Thank you, Ben. And I will do a plug for Ben because his company, FSI, is also a JUST recognized company.
Yes, we are one of 3 in the Baltimore region, along with ASG. Neat program.
So we make that plug because really that is, so social justice and equity is sort of the topic of this program. And another one that we'll be doing in February on food justice in Baltimore. And I'd just like to say a few words about how this sort of came about, because the COAT committee was meeting last year sort of in the midst of the Black Lives Matter actions throughout the country and really around the world. And I think, it did bring to everybody's awareness that maybe we're not as sensitive as we think we are, and we don't know as much as we think we do. And so we thought, well, how can we educate ourselves? And in thinking about that, we said, well, we should just open this up and give everybody the opportunity to hear these programs. Programs, I think, we're trying to have the programs focus a little bit, since this is the AIA Baltimore, and a little bit about planning and how the city has shaped itself, and sort of what the consequences of that have been, given the racial overtones of how that has all happened. So Ruth Ann Norton, I will introduce, but I'm going to ask Nathan, I think our IT or our assistant, to put up a poll. We're going to ask you guys to take the audience to take a little poll while I'm introducing Ruth Ann. And then I think her presentation will address a number of these points, but we'll talk about them at the end of the program. So please do your best, see what you think about these questions. Ruth Ann Norton is President and CEO of the Green and Healthy Homes Initiative, a nonprofit organization founded in 1986 that is dedicated to the elimination of childhood lead poisoning and the creation of healthy, safe, and energy efficient housing. A strong advocate for healthy housing and health and racial equity, she broadened the organization's mission by designing and implementing an innovative GHHI model in 2009 in partnership with HUD, CDC, and the Council on Foundations. GHHI works with over 65 partner jurisdictions, and its model is built on a framework of cross-sector collaboration that effectively integrates resources to comprehensively deliver lead hazard reduction, healthy homes, weatherization, and housing rehabilitation interventions. I've known Ruth, I'm not sure, Ruth, if we met through sort of the architecture and your lead cessation work, or whether through my wife, Lorraine, and your community health work together. But I think we've known each other pretty nearly from the time you came to Baltimore. And that, take it away. I think this will be great.
Thank you, Peter. Been in Baltimore almost 40 years. You know, I tell people that I moved to Baltimore and said I would be here 2 years. About 11 years later, I took a job with the then Coalition to End Childhood Lead Poisoning. They asked me to help them out for a year. I said I'd do it for 2 years. That was 28 years ago. I moved here 40 years ago, so I'm not good with the 2-year thing. But sorry for that, that bio and introduction. It's a little kind of long and boring, but I will say that the Green and Healthy Homes Initiative, in short, which I'll talk to you here about as I load up my slides, came about from our work here in Baltimore, where we're headquartered, because of Joe Biden, actually, who in 2009, at the behest of President Obama, saw a paper that I wrote about the intersection of health and energy and its impact on the moral compass of the US and what we were doing about it. So very happy that it was Joe Biden's office that transformed us, or helped transform us. It's the Green and Healthy Homes Initiative, and today I watched him to unveil a racial equity plan that I'm really glad to see moving forward. And I think all of these things will intersect. And Peter, I think the time we spent most together was on the sustainability work, and I really appreciate all of the good that you and AI are doing. And we had a pre-conversation yesterday of how much I think design has to do with the quality of life and health, and how the outcomes for people. We focus on housing condition, but what you do is give people the ability to breathe, to feel comfortable, to envision and dream. And I think all of that is important. So I want to talk to you a little bit about who we are, headquartered here in Baltimore. We were founded in 1986 by 9 parents whose children were heavily poisoned by lead. They lived at in the 800 and 900 block of North Washington Street. These parents who knew each other as neighbors met again in the intensive care unit where their children were being treated, and for 28-day deep muscle injections to remove all of the heavy metals from their body. But what the parents also knew is that Baltimore was suffering the twin tragedy of deteriorated housing stock and poisoned children, a story that continues today, but founded an outward look to break the link between unhealthy housing and unhealthy children. After 28 years of work, the Green and Healthy Homes Initiative in the last couple of years, reflecting on its own role in social justice, environmental justice, and racial equity, updated its work internally and externally toward a lens of looking at how do we go deeper at higher scale to lift communities, especially Black and Brown communities that have been generationally robbed of the opportunities of wealth transfer, of health and opportunity because of housing conditions. So we now talk about the broad and myriad of work that comes out of our direct service program here in Baltimore, where we repair houses and represent people in red court and help to implement many of the programs in Maryland around healthy housing, to nationally, where we are best known for our work in health analytics and linking healthcare finance to advancing healthy housing and big picture projects I'll talk to you about. But we describe our work as advancing racial and health equity through healthy housing, addressing the social determinants and the structural determinants of health and equity in all of our work and through the 50 employees that work for GHHI throughout the country. So being a headquartered nonprofit who I think punches well above its weight, this is where we work if you want to kind of map it out a little bit. In various projects, we serve as the health advisor to the Energy Efficiency for All network. We represent a multi-state effort on lead poisoning prevention. We actually represent states as healthy housing advisors in places like Ohio and Michigan, where we're launching with Governor Whitmer a big $750 million effort to eradicate lead outside of the work of Flint, which is an important part of that, but throughout their state. We work with the New York State Energy Research Group, NYSERDA, to advance healthy housing states like Connecticut. So we have a lot of work going on around the country, but Baltimore is our home, and Baltimore is where we have recommitted our own priorities and work behind the leadership of Joy Moore, our board chair, and board members that many of you may know, like Doug Nelson, the former CEO of Casey, Ken Jones, the chief financial officer of the MacArthur Foundation, Beth Blower, who leads the Hopkins Center on Civic Impact, but is known for the Coronavirus Tracker, and others. We're all committed to how do we look at housing condition as an opportunity to lift lives and opportunity, but to make the hard choices that we need to do. And because of the history and the deep, deep history of disinvestment in the neighborhoods in Baltimore, in what is in a book, I will recommend two books to you to read in aligned with what I'm talking to you about. One is The Black Butterfly by Lawrence Brown through the Johns Hopkins Press. And the other is Gray to Green, written by my friend Dana Borland, who created the Enterprise Green Communities work, is now at the JPB Foundation. But in all of our work, we're looking at how do the history of ill-conceived and unjust policies and their application play in the lives of children today. How does the lack of housing code enforcement over generations play in the lives? And how do things like the United States of America putting forth a federal call for a uniform baseline housing code policy to lift health and opportunity in 1937, and the next year turn around and mandate the use of lead-based paint that had been banned by every developed country except the United States by the League of Nations in 1921, and mandate its use in low-income neighborhoods throughout not only Baltimore, but the nation. But the good thing was that Baltimore was also the first city and first public health jurisdiction in the country to ban the use of lead-based paint in housing and start a pathway of thinking about health and housing. But the toxic legacy that we know and see, and its impact on the social determinants of health is so strong that we are talking about it today. We have seen how it has undermined communities. But our work in creating better housing is really focused on something that you all know well, I'm sure, the social determinants of health, of outcomes and opportunity. We often refer to them as the structural determinants of health, those things who really put people on a pathway and of where they will, how will they compete, and how will young kids compete in the classroom? Will they be lead poisoned? Will they be suffering from asthma because they cannot breathe, because their houses were not designed to provide good indoor air quality or not updated to do that? Are they suffering from extreme heat and extreme cold, contributing to our problems in climate instead of being part of the solution in climate? And how does that all play into the social context and outcomes, not only in education, but the ability to get to work, the ability to earn, learn, and thrive? I'll talk a little bit about some of the studies that we've done and the work that we have done that talks about that. But in looking at how we have designed policies, how we've designed houses that children who are now living and seniors living with many challenges in older and occupied housing, that's our focus. It's the 30 million families that keep us up every night that are now asked to take these poorly designed and poorly invested in housing and communities and use that as a shield for their health during COVID. We have kids who are staying at home and receiving higher doses of lead, greater exacerbations of asthma. We represent and work with the New Jersey Health Department, who has expressed, Governor Murphy and his administration, we're working together over the concern that people aren't getting their kids to their 12 and 24-month well baby visits, but instead are being dosed at home by mold, mildew, moisture, poor indoor air quality, and lead. And in fact, while lead testing has gone through the floor, is down greatly, as reported by CNN and other news outlets, the rate of kids getting poisoned is higher in places like New Jersey, but even here in Baltimore. I recently had an opportunity to be talking with a family whose child right before COVID, young baby, had a low level of lead poisoning that had been detected. The family was trying to get help with the house because of the shutdown. That young baby at 11 months of age was at a rate of 32 micrograms per deciliter. What we know is there is no safe level of lead, and levels as low as 2 micrograms per deciliter will have aggressive, permanent impact on cognitive abilities and functions of the brain. But it's these 30 million families, seniors, children, intergenerational families living in unhealthy housing that relate to the number one reason that kids miss school through asthma. Robert Wood Johnson Foundation tells us that 40% of all hospitalizations and emergency department visits for asthma are related to lousy housing conditions, high cost on energy, high cost on asthma, and still this many decades and decades later, we're still spending billions every year on lead. This is rooted in how we designed our policies, whether they're banking policies, housing code policies, and they relate now the same communities from 1930 where we started to really break on the redlining and the way we treated and disenfranchised communities. You can see that in 2018, the same communities are where we are still spending money, still on an after the fact basis, rather than doing what is necessary to build community, to build health, and to build healthier housing conditions. And so we are paying that price not only today, but for the lost opportunity that our city and many others have lost out on the ability for kids to reach their full potential, for seniors to age not only gracefully, but with good health and the ability to transfer wealth intergenerationally. We have redlining that is lined up right against not only lead, but asthma and high ER diagnosis rates, on the heat mapping of where we're looking in under-resourced communities and their contribution to the heat mapping and climate change. And as a result of that, suffering deeply from high morbidity rates, high mortality rates. We all know the difference, or have heard the statistics, if you live in Roland Park versus if you live in Cherry Hill. Your life expectancy is going to be cut short 20 years, much of that related to the high morbidities of obesity, cancer, and housing condition. And so this whole aspect of how we have looked at our policies, even when we have put some very stringent policies in place, the lack of investment in looking holistically at standards of housing to enforce those standards of housing. And so we deal every year with these issues. You know, not this past election, but the one that was won by Catherine Pugh for mayor. I went to one of my, to a mayoral forum. There were 11 candidates, 9 of them said lead poisoning and the housing condition were going to be their #1 issue. And yet we remain in stagnant place, while other communities that I will talk to you about are now seeing large investments from hospital systems and health systems, are seeing higher scale funds that they are saying it is time. Looking at post-COVID reality, looking at the illumination and lift again of something that's not news to us, the racial disparities that are coming out of housing. This can change, but it's a deep problem that really undermines the rest of the work we do. And these same communities that are hyper segregated, you see Baltimore, Birmingham, Chicago, Cleveland, Detroit, Flint, et cetera, are the same communities that I work in every day across the country, struggling from these issues of poor housing condition, and some that are throughout this list, from Philadelphia to Chicago to Cleveland. These are the stories, but it's grounded in our communities where a child lays their head down at night, where people are living, and how we are looking at their outcomes today, but the urgency of what we will be looking at at a post-COVID reality where less investment has gone into housing. And as I said, high dosing, high injury, high lead, high asthma coming, and in these communities where over 70% are Black and brown communities are getting this dose of poor air quality that is exacerbated carbon monoxide levels, exacerbations of respiratory disease. So we're trying to build equity in the work that we're doing. You know, we did a study around how do we, if we take evidence-based practices on things like asthma and indoor air quality in Baltimore, and we worked with the U.S. Department of Housing and Urban Development, hiring from the community to repair in the community those things such as leaky roofs and ventilation and weatherization so that we don't have extreme heat and extreme cold. And we took those measures in 240 homes, 139 of which had kids who were chronically missing school 20 days or more per year. And our results were that we lowered hospitalization rates by 66%. We improved perfect attendance in the year following by 62% for those same children, and 88% of the families were able to get to work at a higher rate and be able to maintain their jobs and advance in their work because we were able to stabilize housing, make it healthier. But what we also did was deliver hundreds of thousands and millions of dollars back to the state Medicaid program and to the federal government, because we weren't having to pay for high cost of hospitalizations. And instead, we were creating savings that today we're now changing our work, or have changed much of our work here and around the country, that we're getting healthcare to invest in that work. And in Baltimore, AmeriGroup invests in the work that we do to align, grade, and coordinate resources that to lower lead hazard control, to reduce asthma, to fix measures on fall and injury prevention, something championed for older adults by the Weinberg Foundation and many others, and improving energy efficiency and health by aligning that work together. By doing that, we're able to take philanthropic dollars, federal dollars, and think about the private sector in how we redesign the health of housing, how that relates to a larger community design. But what we also know in a study done by the Center for Employment Opportunity, CEO, at our work that we did in Buffalo along with Cornell University, that study showed that we raised the wages from $4,000 to $8,000 a year for the workers who are cross-trained to know how to address energy efficiency while lowering lead poisoning and things like mold, mildew, and moisture. But what we're also doing is making programs much more efficient. What got the attention of Joe Biden and Barack Obama to invest in our work is that we pointed out the fact that in Baltimore, for example, having housing with poor leaky roofs or poor indoor air quality or poor design on the energy efficiency was causing 62% deferral rate for grant programs intended for their lowest income community members, and where that money was needed, 62% of the time we were deferring it, we were setting it aside because of the health issues related to housing. So we have a whole house strategy to change that and to change the future, to think forward about what it means when we actually remove lead hazards, we reduce asthma triggers, we prevent injury for seniors, and we look at things like radon and asbestos and energy efficiency together to look at that whole house strategy. And what does it mean from a public dollar investment to what we reap as taxpayers, what the government reaps in efficiencies, and what families reach in opportunity? We have opportunity to invest dollars with community, to be owned by and driven by community, to improve their health, and to think more broadly about the other needs that come in that. So we integrate in our work food and food strain and food security, finance and budgeting, while we are working with the family on a household support plan. But we have much higher rates of success in that when we are trying to work on those issues if the environment in which they live, they can see and feel the improvements through better space, through better quality in thermal comfort, and through the air, literally, they breathe and the roof that's over their heads. So we've done a lot of work about the non-energy benefits of energy efficiency and weatherization, and moving that work to opportunity in higher school attendance, neighborhood quality improvement, economic productivity, and better outcomes on test scores. Kids poisoned by lead are 700% greater to likelihood of dropping out of school than their peers, and will earn less, about $1.2 million less than they would just with a high school diploma. And so these are impeding factors, not only that, but long-term, beyond the drop in IQ, in a collective, high drop in IQ collectively, but about 2 points per child, they will have a 16 to 19% greater likelihood of cardiac arrest and a 46% greater likelihood of early mortality. So we have some priorities to change this. Working with the new administration coming in, we've been very busy in Department of Energy to HUD to Health and working to support Ambassador Rice in her new role in the domestic work that's going to happen here, to align streams of funding and to make it easier for low-income individuals to tap programs that can make their house healthier. We shouldn't run people through 18 different ways to qualify. If your kid's on WIC, if you are on SNAP, if you're on Medicaid, you should be able to tap programs designed to help you, to train, cross-train workers from community to own those jobs, to advance policy around building the moral compass of better housing condition as a start for better community planning. And so we're able to also look at things like healthy building materials and its importance in how we do that work, training workers to utilize healthier, more recycled and greener materials, because the off-gassing alone is a health issue, but our work in climate justice, GHHI's work around the country in partnership with NRDC and Sierra Club and other places around the country, we are committed to how the materials we use, the practices we use to be evidence-based, to be climate friendly, and to be moving forward this opportunity from solar to cool roofs as a jobs movement in economic mobility. And we see that we're able to do that. Some interesting things that we're doing. We are working with hospital systems around the country to tap what is called hospital community benefit funds, those monies that have to be reinvested by nonprofit hospitals in lieu of taxes. And just recently, with the University of Pennsylvania, we got a commitment for $50 million cash investment in Lancaster, Pennsylvania to eradicate lead. We are working with NYSERDA in New York to team up with their Medicaid system to create a fund, $10 million fund for health and safety that will be replenished through Medicaid reimbursement, because we're lowering the cost of health care and improving outcomes. We are working in the state of Connecticut to align this as a way and a practice that of alignment in working together. And then we have healthcare reimbursements like AmeriGroup's reimbursement here for our work in Baltimore, but we're seeing that in Utah and Michigan and Rhode Island. And in Michigan, we're building this fund with Governor Whitmer to eradicate lead at a high level. In New Jersey, we are supporting a whole house model project through their public utility network and their health network to bring that together and align investments so that the standard of housing will be driven by health and energy standards in doing this. And then we are working on outcomes-based financing from the private sector that will invest at scale to improve health and will receive payments back from the healthcare system for the outcomes when we lower hospitalizations, improve and lower emergency room visits, and instead get kids to the classroom. So we're working across the administration on weatherization issues, cross-training workers, establishing a big national fund on lead and healthy homes. We have proposed $100 billion investment to the incoming administration, and the good on lead. And the good thing about that work is lead is one of the most bipartisan issues that the Congress, even the current Congress, supports. And in fact, we were able to triple the amount of money going into lead hazard control and healthy housing in the crazy Congress that preceded this one, because it is one issue that is championed on a bipartisan basis. In Baltimore, we created housing choice vouchers based on helping families to escape lead hazards. And now the Baltimore Housing Regional Partnership is advancing that to create a healthy housing public voucher. We just completed excellent work on getting the mandate for carbon monoxide detectors in public housing. If you can believe that that wasn't the way of the standards coming out of HUD, and we got federal public funding for that in the last stimulus to ensure that we will make sure that carbon monoxide is the standard. And we're using things like Medicare Advantage to pay for injury prevention. We're building that case, and we're drawing down unused administrative dollars from the Children's Health Insurance Program to create healthier housing for energy efficiency, for asthma reduction and lead poisoning prevention. I'll just tell you as I close these remarks, I'd like to get into a dialogue more with you all and with Peter, that when I go to work every day, this is the headline that I think about. In 1991, just shortly before I began the work at the Coalition on Childhood Lead Poisoning, now GHHI, the Baltimore Sun said efforts to eradicate lead would be doomed to fail, destined to fail. Well, these kids, the ones I worked for, were children of those 9 parents. They stormed City Hall in 1991. It was not an insurrection. But they wanted to make the point that we were using kids as canaries in the coal mine, whether it's on asthma, whether it's on radon injury and housing condition, and that we were impeding their futures. I'm happy to report that this number is actually now 99%, that we have reduced lead poisoning, taking Baltimore from the #1 place in the country for the concentration of lead. And we've lowered lead by 99%. And Duke University, my arch rival college, says that our work has produced a $44.5 billion economic return out of that work. But what I want to tell you, that should have been good news when it came out in 2017, that particular study. But it instead forced us to look more deeply at how do we think about housing condition holistically? How do we think about equity? Because what we know is the $44.5 billion that we helped to create up until that time wasn't going back to the communities who had long been robbed of their opportunity, wasn't producing the overall outcome on housing condition. We now think we have that better opportunity to understand how to create jobs, how to tie it back. We're hoping that we will see some of these same large investments that we are looking at from around the country. A multitude of those I'd be happy to talk about all day long that we're doing in many places around the country. But what I'd love to do is get into a dialogue with you, Peter, and others about the work. Please follow us on Twitter at Healthy Housing. If you want to hear about my dog, my puppy, Dexter, and some of the trials and tribulations of going through state legislatures and working on transition plans, you can follow me at Ruth Ann Norton. But I just want to say how appreciative I am of those that think about design work, that think about place, whether it's where we work or where we live, and how we think more holistically. But the environment in which we live in reflects so much of how we feel, and it reflects so much of our outcomes. So not only are we now working on these issues of lead and neurological health and respiratory health and preventing injury and the like, but we're also thinking about emotional health, mental health, and trauma from space, in the space and places that people live. And we'd love the opportunity to work with any of you on how do we add value to your work in this. But let me stop there and say, Peter, what do you want to talk about?
Well, I thought we'd go through these questions in the survey real quickly. One of the questions actually gets to something that I wanted to ask about, which is sort of the timetable, over the course of years that Baltimore's been doing what it's been doing, or cities around the country have been doing what they've been doing. But anyway, first question is the life expectancy gap between residents of Black and white neighborhoods in Baltimore City. The correct answer is 20 years, which I was shocked. And you mentioned it in your presentation that
Yes, so somebody got to cheat on that answer, at least maybe.
well, no, we asked them to fill this out before you started.
Yeah, there you go.
So the majority selected 16 years, which is close, but 20. I mean, I was surprised. That's a big.
Well, it goes to, but if you think about not only conditions of where people are, especially now, spending so much time in their homes, but what's also getting trapped in there if you live near the incinerator, if you live near the chemical plants, if you're in Cherry Hill or Brooklyn, you are surrounded by toxics that are just in your house all the time. So these high rates of cancer and morbidity. Elijah Cummings one time, we were walking through neighborhoods and he said to me, where he grew up, it was normal that kids had lead poisoning, normal that you suffered from asthma. It's just normalized, and we got to change the normalization of that.
The second question was the following health impacts are correlated with community level housing condition and racial segregation. And the answer was all of the above, I assume. Is that?
Yeah.
So everybody got that one right. The gap between home ownership rates for Black and white residents in Baltimore is, and I don't, the answer to that was 16%, right? Or 18%. Mm-hmm. Okay, so most people guessed 21.
Yeah, and you have the answers. I gotta, but it's high.
It's high.
Yeah, and the thing that we are working on in the housing upgrade benefits for seniors program that we do with neighborhood housing services, Civic Works, and others, is obviously to improve the life and quality of health of older adults to age in place. But part of the agenda the GHHI has in that too is helping to improve the health of housing of the elderly. So there's an opportunity of intergenerational wealth transfer. In the white community, the higher rate and some of the steadier kind of equity built over generations comes from home ownership. That is often not the case in Black and brown communities. So we're really trying to change that.
So this is more an issue of intergenerational transfer of wealth than it is of health, or is rental housing versus ownership also a public health issue?
Rental housing is a massive public health issue. There's a loss of wealth there too, because when families flee bad housing, if you have property owners who are not holding up to standard, most are, we recognize most are in the business to do right, but where there is not, the loss of your goods and the loss of security deposits and the cost to re-up again and to move. Not only is it the trauma and the chaos, but there's also loss in jobs and school attendance and in marginal wealth retention that starts to mount and is no longer marginal. It becomes critically important for folks.
Neighborhoods that are less than 50% African-American receive nearly blank the investment of neighborhoods that are over 85% African-American. And the answer was, it was 4 times, was it? I think. So that one was correctly answered by the majority. And this is the one that I kind of wanted to get at. In what year did Baltimore City pass the nation's first housing segregation ordinance directed at Black people? I assume this was housing segregation ordinance. This was creating segregation by law, right? And the correct answer here was 1911, I believe. So you know, I
We
think,
did a lot of things early here.
huh?
We passed a lot of good laws early. It's just whether or not we upheld them, you know.
Okay, so this law was to desegregate the housing or to segregate the housing?
Oh, well, let me see how we did this. Oh, segregation. Yeah, this one's not, sorry, I thought you said desegregation too, and I'm looking at the note here. So,
Yeah, I mean, so this is one of the,
yeah.
you know, I think a lot of us sort of associate sort of the worst of the racial inequities sort of to the late 1800s, but you know, things were happening into the 20th century, and I think some of the laws that began to create more equity, when you look at the years that they passed, I mean, they were like in the 60s and 70s. I mean, it just seems like so late. You know, I'm always kind of surprised at looking at the arc of history and when we choose to do things, you know.
Yeah, sorry, I got that one. I was looking bad at the answers on this and got that completely wrong, and you're right. But you know, my point on this, Peter, was too, that we did a lot of things early, right? I said, I was talking about the housing, you know, the uniform housing code around health and safety, and then turn around and reverse that by saying we're going to put a toxin, a known toxin. You know, in 1904, Sherwin-Williams had a board meeting and said they would not participate in manufacturing lead-based paint because it was literally killing babies, and the babies of, you know, both in utero and after birth. And in 1908, they entered the market because of the money drive on it. In 1921, League of Nations bans lead-based paint. In 1937, there's a call to have a uniform health and safety standard in housing across the country. In 1938, we mandate that this toxin go into housing. In 1949, the Maryland legislature tried to pass a ban on the use of lead-based paint in housing because of how bad it was and how many kids were dying and the impacts that were happening. It got reversed because the university said they were studying it, so the governor didn't sign it. So Emmanuel Kaplan, who was a deputy for Huntington Williams, the public health officer here in Baltimore, said, forget that. He banned it for use. But when in the late 80s, early 90s, there was a landlord who was shut down in Baltimore for terrible, terrible practices of like fixing one unit by stealing the bathtub out of one and putting it into the other and then claiming it was a robbery and just terrible stuff. And the community law center had taken receivership from this guy, but they found warehouses full of lead-based paint a decade plus after the United States banned the use of it, still using it. And it was used because it was, you know, durable and so it was, you know, used by property owners to do this. But it's not just those practices. It's repair practices. You know, you and I talked about the investments of even good-minded investments in housing, where we don't think broader about equity, about health, or about how we build community in a way that helps thrive. So
a couple of questions, and we are getting some up here on the chat box, but you know, you've discussed a number of inequities associated with redlining. Are there other sources of pollution that affect communities that are not related to redlining? It's sort of just a matter of choosing sort of poorer or other disadvantaged neighborhoods as the place to locate a particular type of facilities.
well, I mean, you could say they're not really redlining, but they're all part of what I will call at best unconscious collusion. right? The highway that gets built next to the low income neighborhood in Detroit and causes massive, asthma. Where we put incinerators, where we don't, it sort of builds on itself too. When I started to do this work in the early 90s, the housing commissioner at the time and the Baltimore City Housing Department said, why would we possibly invest resources in communities where the house is so poor and in such bad condition? And by making that decision, right, to not do that, because it's, not worth it, so to speak, is a decision to really damn that community to completely not be worth it, keep moving down. And what nobody took time to think about, and even when they did, it didn't carry the day of those kinds of decisions, right? Where there was either high crime and people didn't want to do something, or we made decisions that by lobbying that said if we had standards, good standards that we all want to have in our neighborhoods and that everyone should strive to have, that if we did that, we would push investment out. But by failing to do those good things, right, we drive it further, and we drive the Medicaid cost up, we drive the crime cost up, we drive the other costs that come with this, but we obliterate opportunity.
Mhm.
And when you obliterate opportunity, we are costing all of us the brilliance that could have come from one child or more, and things that could be built. And what we know is if we lift that to a standard of good health, we start to create other savings and other opportunities for investment. Because wouldn't we rather be investing in the music center, or having a hardware store, or a coffee shop, or a field for kids to play in, because we had those resources in a community where people were healthy and able to access them and use them. But you literally lower crime and you improve health. And when you do that, the community takes on its own resilience for opportunity. But it's not all, I mean, it's redlining in different ways. But I think so much of our just downward moral compass on housing condition has come from unconscious collusion. We look at structural racism in America, and much of it advanced by institutions that just started to do it, have the implicit bias, and have the discriminatory practices without even having to almost think consciously about it. And then it goes to all of our decisions, but certainly goes to place.
I want to get to some of the, I have a lot of follow-up questions, but I want to get to some of these from the audience. So we have a question about the past of affordable housing. Do you think it would be improved if it was 100% public funded and not developed by the private sector?
Interesting conversation just recently, serving on a transition committee for Mayor Scott on housing, where a luxury housing developer who was on the committee and with other low-income housing developers were talking about low-income housing development in, I want to say Hampton or somewhere in town, where the development is $400,000 a unit, right? And being financed by low-income housing tax credits and so that called for wow, we need to pay attention to that private kind of development of this, and it didn't make sense. And whether it certainly spurred a lot of offline conversation. I think there is a really though good and healthy way to do private sector investment in low-income communities to build sound and healthy and decent and thriving housing, so I don't think it all has to be done by the government. What the government can do well is to really have the courage and commitment to standards. When we said in Maryland that we were going to have a commitment to a standard about pre-rental inspections on lead in housing and be willing to just simply enforce and uphold that standard, the market moved to the standard in large part, not entirely, not done, not close, but we were able to move a 99% reduction in childhood lead poisoning, mostly financed by the private markets, but guided by the standards set by evidence by government. And public housing today has had its own troubled path. If you look at NYCHA in New York and the billions of dollars of damage that's happened on lead, or the fact that we had to just tell public housing that having carbon monoxide detectors should be a mandate, or that there should be a health-based standard for housing choice vouchers and for those landlords collecting on rent through housing choice voucher. So I think it has to be a mix, but it is the courage of standards and being able to then track what evidence-based and standards do and the investment and upholding those standards. That's the basis by which we have to move this forward, I think.
So I think that's related to a second question, which is when it comes to renovating existing affordable housing, what do you think gets overlooked the most by designers and developers? And I guess, this question is coming from a designer. What should we look out for most in our renovation projects to make sure it's addressed?
Well, I think a good envelope on indoor air quality, right? That really helps us. The moisture is the root of all evil on houses. It causes paint to chip, it causes mold, build, and moisture, it causes things to rot and disrepair. We have been really blessed by the movement around energy and efficiency, around climate, around wanting to think more holistically. Housing is better because of it. I think designers today are amazingly important in this, thinking about well standards. I also think we've got to think about ingress and egress as we think about populations that age. One of the factors on social mobility is just the inability to get easily in and out of housing, and the ease in which we open to green space. At heart and soul, thermal comfort, indoor air quality is key, but building materials are also key. And taking the time, we're improving that every day. We're improving those standards around building materials. The Healthy Buildings Network, which is out of Minnesota but working across the country, has done a great job of this. But I think having just good space where the air is clean, where there is thermal comfort, and we're able to control things around moisture. If we could do two things in the repair of housing, roof repair and window replacement are critical, right, across the board. But it has to be supported by good airflow and quality, indoor air quality.
So, I think
and light. I think light is super important. We don't think about it enough. You all do. I think it has a lot to do with people's health.
Yeah, it's important. So I'm just thinking, I think new housing, Maryland's pretty progressive on the codes. We always adopt the latest code, and I think new buildings are good, here in the state, but a lot of housing renovation gets done by real estate investors and small-time developers who are less sophisticated and so on. Can you talk a little bit about sort of how that issue, is that an issue, and how that can possibly be addressed?
Well, it is an issue on ongoing maintenance, right? Now we're in COVID, so the the ongoing necessity of essential maintenance practices and investment in that is really troubling. But when you have absentee or small pocket investment, in many cases, that maintaining a house becomes, a big challenge. Number one, and, accessibility to have for tenants to have a relationship that they can be in touch with and communicate gets challenged. Some of the bigger and larger property owners do a better job of having a standard of care. But one of the things, again, it goes to how communities have standards, how there are envisioned standards of how we bring back to life occupied housing and vacant housing to get it to be occupied of existing housing, is thinking about how it plays into a neighborhood and how we connect it to green space, or how we connect it in things, everything from, sidewalks and making sure that and trees to, connection to that green space. Clearly, we work on the fact that where people are spending a large part of their time, where they sleep at night and wake up in the morning, where they right now are schooling their kids and being the entertainment and everything else, but how critical that is. But I think even individual investors or larger investors have to think about place in the community. But this is, again, I hate to be the broken record, is where standards and the willingness to enforce certain standards, not take away individuality or creativity or any of that, right? But to have certain baselines that say, this is what you must do as a baseline. It's a product like any other. If you invest in it to put it on the market to rent, it's the same as putting food on the market or manufacturing of a car. You're putting something on the market that should be brought to the market that is not known already to going to send your kid or your older adult to the emergency room for asthma or poison them or the like. And so this idea of standards and how we do that. But cities like Baltimore suffer a great deal from absentee investment.
Hmm. So one more question, which might be related to that, or could be related to that, I suppose, is I imagine there's been a fair amount of legislation. I mean, you've talked about a number of things, but is there some other piece of legislation that you would pass now to improve affordable housing in Baltimore, the effectiveness or the quality or?
Well, I would have a health-based standard that we agree would have to be a baseline standard and may need federal, or state support. I would allow impact investors to invest in helping to address the ills of unhealthy.
What is a health-based standard? What is that?
Toxic free, dry, thermal comfort. There's 8 standards of it, right? So that things that making sure that we have proper standards that we don't have toxins such as lead and radon, that we have proper indoor air quality, we have structural soundness. If you go on our website, you can see the 8 elements of healthy housing. But by adopting those standards and allowing a mechanism by which healthcare, who may have people living in those homes who are repetitively using a hospital because they're being hospitalized for asthma, high rates of injury, of preventable injury, right, especially in older adults. And if we can fix those, there's huge savings that happen in the healthcare system. And so in New York City, we are using private sector investment from a big industrial bank who is funding at scale asthma reduction programs in the 5 boroughs in New York as a post-COVID measure, because we know that we need to address housing condition. And the healthcare entity, Affinity Healthcare, which is known now by Molina Healthcare, will be paying back the financing with savings created by the lowering of hospitalizations and emergency room usage. And they still will do fine at the healthcare system. And they're going to take the spread on the savings that they have and put that back, because the CEO of Affinity Healthcare, Mike Murphy, had said to me very early on, part of advancing health and wellness is where people live. And so being able to provide a service out of the healthcare system that when, if you go to the Harriet Lane Clinic, you'll have doctors who are providing, inhalers and asthma medication, knowing that they're going to send a family back to a house that's probably going to be triggering asthma. And if we could just take care of the root causes of that, pest management, air sealing, indoor air quality, right? As I said, eliminating the extreme heat and extreme cold for thermal comfort. Get rid of carpets when you can use flooring, old carpets when you can improve the flooring. And you do those things, people have a better quality of life, kids get to school, people get to work, they're more stable, there's less turnover. But we create lots of savings in healthcare. Healthcare can be a very important investor in creating healthier housing, especially in occupied housing, because there's such a benefit that happens in community. What you also can do is hire community members and train them to the work. They can be part of also the data and evaluation work so that it's done responsibly. There are health educator roles in that, and these are all jobs, that full-time jobs with full-time benefits. Environmental risk assessors will make somewhere between $55,000 and $80,000 a year. And people can be trained to do that with health benefits. I have guys working on our construction crew doing environmental health risk assessments who were housing challenged at best when I met them, and now are skilled contractors helping to make Baltimore better. So there's lots of opportunity in this, but especially healthcare has been charged with driving and advancing social determinants of health. And they have funding to advance social determinants of health. So they are and should be and will be partners in how do we redesign, reinvest our way out of this problem we have in occupied housing.
Well, this has been great. I'm being told we're at our.
Yeah, we're over time here. I'm sorry about that.
No, not a problem. But I think, what you're saying is one of the things that keeps me fascinated with the work that we do is that in this sustainability world, all of this stuff is so intertwined. It's just fascinating to me.
Read Dana's book. It's a short read, but a really good read. And somebody put the full title up there, which is, but she's one of the best human beings around. Yeah, and loves design, so you should ever come and talk to you. She's way more fascinating. But also Lawrence Brown's book on the black butterfly for people who aren't acquainted to that as much around the history of Baltimore really gets at it at a much deeper level and from a different lens.
Well, Ruthanne, thank you very much.
Really appreciate you all. Thank you so much. And thanks for all you do for helping us to make Baltimore a better place. So thank you.
Thanks. Nathan, Kathleen, either of you want to say anything or just hang up?
Hang up. See you later.
Just thanks again, Ruth Ann. Really inspiring and a great call to action about how the design community can really be engaged in all these issues. So.
Well, we appreciate that and support GHHI if you want in any way you can. But talk about healthy housing as a need for every citizen. If we do that and we do it well, 20 years from now, we'll have a different conversation about all the brilliance that we will have helped to lift up
Absolutely.
So they'll be great. So thank you.
Thank you.
Good night, y'all.